Like I said, I landed here in '84 in August, and the first community I worked in was your neighborhood, the South
Yeah.
End. I think you were about one of the first people I door knocked, and I think you knew I was pretty green, but you were very, you were very patient and talked about some good issues. And so, one of our jobs is to actually get people to join uh, the community, Acorn, the community organization, and pay money then and there for dues. And so I was scared to death of doing that, but it was thrown out in there, and it began to happen. And so the South End was the first area. We I was semi-successful in building a group. The issues were very small neighborhood issues. Then next I worked in the East End where there were some big issues. My next community was Dixie Addition in North Little Rock, and that probably is the neighborhood I love the most. It is sort of off, surrounded by railroad tracks. The big issue, the first big issue, was a chemical spill. And the Missouri Pacific Railroad had spilled a bunch of toxic chemicals. Our members were evacuated New Year's Eve. And after that, lawyers, of course, ran. This was shortly after the Bhopal incident in India. And so it was hot, so there were a bunch of lawyers who began to sign people up. So one of the things we did was get all the lawyers around the table and developed a common strategy. And Jay Youngdahl was probably the top lawyer. John Walker was involved, Brent Baber as well. And so we also did actions on MOPAC, and the lawsuit resulted in folks getting a pretty good compensation. Then there was flooding, I think the following year, where people had, again around Christmas, New Year's, they had to canoe out of or go out of their homes on rowboats. We began a whole series of campaigns to fix the drainage, and we were successful in getting just a bunch of streets fixed, the big drainage ditch covered and cleaned, and one of my favorite actions was taking the director of public works on a tour, and one of the Dixie leaders coming down so hard on this guy that he began to cry. And yeah, one of the things that I like about the organization that I work with is that I'm an outsider, and I don't want to be anything else but an outsider. I want to know and be welcome in the communities, but I can't speak for those communities. So I think what makes our organizing unique is that we develop leaders quickly, and we work with them, and they become the spokespeople for their communities. And they're ordinary folks, so they're not always the most articulate, but we believe they're the most effective because they humanize when a neighborhood is starved for city services or neglected. You want to see a face. What is it? What happens to people? What are the people they're concerned about? And I think that's, to me, more effective in getting the things you need. We also believe direct action is effective because sometimes the process doesn't work and hasn't been working for people in those communities. So confrontation sometimes gets you further than going through the processes that people have laid out for those communities. And so we combine confrontation and then negotiation to actually settle on the win. We really have enjoyed the partnership. We think it's a natural fit because our communities are often some of the most unhealthiest communities in Arkansas. And it's where the delivery of health services and education is most needed, and I look at that as broadly construed. So I include environment and a number of things. So our first partnership was with Dr. Ferguson on the Apple project, which was, I think, really successful. We were funded by EPA, and we did workshops in several communities in Arkansas, and we worked closely with HIPPY and College of Public Health, Health Department, and ADEQ, and had great workshops. Some were small, but we had some numbering close to 100, both educating contractors, particularly community contractors, and also neighborhood folks who live in the neighborhoods, to let them know about how to, we actually did test. We were certified to test homes, and we did about, I think, a dozen or so in central Little Rock. We found that the vast majority had high levels, unacceptable levels of lead. So we're hoping that Apple helped people. There are ways you can sort of cope with it for a while and then train people about the dangers of lead and how to make the home lead safe.
And that's training the homeowner.
Yeah, training the homeowner and then the contractor who will be working on older homes on how to deal with lead. And they actually got a pre-credit towards a certification that will be required for a contractor. And the other project, of course, we had an internship, and we had a great intern, Randy Lee, who's an official with the Department of Health, and he helped us with our hospital accountability project, and we're basically looking at whether nonprofit hospitals are making known to patients charity care, free and discounted care. And we're glad to say we got some provisions in healthcare reform that will help us do that. So this is an ongoing project. So Randy helped us with a phone survey where we had community members, people affected by the problem, calling to inquire about charity care. And let me say first, we see healthcare as a long-term project for us. It is on our agenda and a focus. And again, I look at this broadly. Maybe it should be healthy communities. So including environmental justice, including access to health care, including access to healthcare education. And so looking in the near future, while not entirely happy with the healthcare reform, think it's a great step, and we want to see it implemented. So we would love to have an intern to help us get out there, educate the community, enroll people in programs as they begin to be created. And I think we would want, the kind of person that we would want to look for is someone who does have an understanding that there are communities who have been left out because of historic discrimination, both by income, by race, often by gender, and that you have to have that understanding first. And someone who is passionately on the side of those communities, but has the objectivity to develop strategy, be able to discern what are the best ways to make things happen.
To advise you like you get a college of public health?
Well, I would say I think it's important to keep working with the community, find partners in the community, because that's where how you're going to penetrate underserved communities is to talk to the people who do work in the communities and partner with them. And it is a way both to learn what's going on in those communities and a way to get information to those